Welcome to Medicine, Motherhood, and Missions, the podcast where we dive deep into impactful and inspiring conversations with amazing professionals who've turned their challenges into stepping stones for success. I'm Johanna, your host, and each time we meet, we'll explore the stories and journeys of remarkable individuals who are PAs, doctors, professionals, mothers, and mission-driven changemakers, from the halls of the hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between, and see life through each other's perspective. If you're seeking fulfillment in your career and life, I've got something special for you too. Download our free guide on how to be a fulfilled provider. It's packed with tips and insights to help you thrive while balancing the many hats you wear. And for all those parents out there dreaming big while raising little ones, check out Little Evie's Big Dreams children's book series, available now on Amazon. These heartwarming stories inspire kids to chase their own dreams, just like you're chasing yours. So grab your favorite cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Hi friends, we've got Marlene Morris here. She is a doula, an educator with Agape Code Doula. She has a passion for maternal and child health, particularly in the Black and minority populations. She is well-traveled and she's currently in Ethiopia. Thank you, Marlene, for coming and joining us today. Excited to have you on and to hear a little bit about what you do. Tell us a little bit about yourself and what you love to do for fun.
Thank you for having me. And I am a birth worker. Actually, I'm calling myself a birth ambassador now because I travel to so many places. I'm 200 plus births under my belt, 6 different countries. And so when you say, what do I love to do? It is travel and help moms and babies, you know. I love learning about different cultures. And so been to 33 countries now. So my passion and love is combined with my heart's calling, which is to help, you know, ease the pain of labor and help babies get here safe.
Yeah, it's really remarkable that you're able to combine the two and have the opportunity to travel and work with so many different populations, cultures, and people groups with your actual training and love for maternal and child care. So that's really neat that you've been able to do that. How did you start your journey into being a birth ambassador and doula and, you know, maternal health, all of that?
Okay, so about 9.5 years ago, I connected with Birth and Beautiful Communities, the founder, Kristen Farmers, and really, I had no idea the issues that were behind maternal health and child, you know, birth, but learned that through being a part of that organization. But that organization also provided sisterhood. And so we were basically a sisterhood. We was a doula collective that really assisted our community, and our clients would then form their own sisterhood, and we would see them going to each other's, you know, weddings and things like that. And so that was the beginning of my journey. And since then, I've become now a midwife assistant / student. And so I've just increased in, you know, my training and education and love for the work. And so I can do basically anything: birth, lactation stuff, childbirth education, overnight care, postpartum care, all the things. So it began there initially.
Yeah. And I know when I first spoke to you, I mean, you're a very dynamic person, and you were talking about how you had helped kind of start that Black Birth Collective, right? And kind of saw the need for advocating for those populations in that city that you were working in at that time in Ohio, I think, right?
Yes.
And
So
so you were really integral in kind of helping bolster that community initiative. And so that was really amazing. You're just such a dynamic person in how you work and your passion. So I really hope the listeners can get that understanding of just what you do. It's really amazing.
so that's
Yeah.
something different, and that came about like 3 years ago. So,
Mhm,
Birth and Beautiful Communities, which Kristen Farmer started, and I started my journey as a birth worker.
mhm,
That's different from what we started as a collective about three
mhm,
years ago. So, after no longer working with Birth and Beautiful Communities, or basically beginning to exit out of it, we started the Black Birth Collective. And that was
mhm.
for doulas who were not a part of an actual agency. They were doing their
Right.
private
Okay.
work. And so what we wanted to do was provide that sisterhood that I had at Birth and Beautiful Communities initially when I
Mhm,
started there. I wanted to provide that for other birth workers that was in the field that was kind of independently out there.
mhm,
So our collective includes birth workers, midwives, massage therapists, childbirth educators, lactation consultants. And how we initially started was because I was a part of Reparations Now Cleveland during COVID and doing all that,
yeah.
racial tension and police brutality and all of that. And so one of the things they wanted to do was give back through mutual aid. And so I was receiving funds from that. And I thought, well, there's a whole community of birth workers who sometimes have to do their work pro bono because they want to help these families. So let's try to filter that money into these other birth workers. And so
Mhm,
we basically had to become an entity in order for them to filter funds.
mhm.
I never want to be the lead or something or like this. Like I prefer kind of to sit back, but I wind up becoming the president and co-founder of the Black Birth Collective. And from that, we have been able to raise, I think, over $19,000 worth of funds. We've been able to get funds to get medical supplies to 3 or 4 different nations, because that's also one of our things. We wanted to bridge the gap
Mhm,
between Black birth workers and African birth workers in
mhm,
different countries: Senegal, Kenya, Ethiopia. And so we've been able to do that within the past 3 years. Like we're really young,
mhm.
but we've been able to help connect families with birth workers. Basically, we are there to support birth workers because the work that we do is very draining mentally, spiritually,
Yeah.
physically. And sometimes we forget ourselves. We forget self-care. So we have thrown several different events that birth workers can come and do a sound bath or yoga or just simply be in silence. We've done speed dating so that the community can get to know the different birth workers, and other birth workers that don't know each other can get to know each other too. That was one of our successful events. We had one called Babies in Bottles, or Doulas in Bottles, where we went to a winery and we just enjoyed each other, and got to meet other birth workers and just wind down.
Yeah.
So yeah, we've done a lot in a little bit of time. We also had a spinning babies training and different trainings that have come, that we have been able to help sponsor birth workers to attend, which we wouldn't normally be able to attend because those trainings are quite expensive for some of us. So we've raised
Mhm.
money to be really able to supplement our work as well as help us to become, educated and supported in different areas. So, yeah.
And so, what is a doula, and how does it differ from a midwife?
Mm-hmm.
Or
That's a
are they the
great
same?
question. Great question. I get asked all the time. So, what I like to say is the doula is at the head of the bed and the midwife's at the foot of the bed. So,
Mhm,
the midwife is catching the baby. The midwife
mhm,
is doing the clinical aspect of labor, birth, pregnancy. So the midwife is going to be the one who is doing the prenatals, doing the checkups, like I said, catching the baby, whereas the doula will be the one that is advocating and educating the mom, the family, and supporting, infant mortality rate and maternity mortality rates are high in the states. And so
mhm.
having someone there to be an advocate for you, to help you understand what your informed consent is
Yeah.
huge in America. And studies have shown that having a doula helps you decrease cesarean rates, decrease
Mhm,
literally death. Like it keeps you alive
mhm.
because you have someone to advocate for you when you have a pain or when you think you're in labor and they're telling you not to push, or they're telling you,
Yeah.
different things that because of your body, you've been educated. And so, things are kind of either not in order or no, actually, I do need to push this baby out,
Mhm.
like I don't need to wait. I need to actually push my baby out. So we're more advocacy, education, and also physical. So we are the ones that are doing the hip squeezes. We're continuously there throughout the labor process, throughout pregnancy. So we really know, our clients by the time it's time for them to have a baby, because they're
Yeah.
typically coming to us 20 weeks or later is typically, some come way earlier than that.
Right.
But most of the time, they're coming about the 20-ish week.
So I know there is a high infant mortality rate in certain populations in America, which you have seen populations in different areas of the world, and it's quite amazing that despite the advancement in healthcare here in the U.S., that we're still seeing um, this high infant mortality rate here in the US, and maternal health as well, challenges. And so, what in these communities are you seeing that, from your experience on the ground, are you seeing that are the challenges that lead to that higher infant mortality rate and maternal health challenges?
So I believe that we're not listened to. I wrote or co-wrote a documentary song, and one of the verses that's in there is, "Do they not see me? Do they not see their mother, sister, daughter in me? And will they not help me? Like, why won't they help me?" And that's essentially it. There's been times where I know clients have complained about pain or have complained about something and they weren't heard, actually was sent home. I have clients who were, told um, just various things. Like I had a client who the midwife would not told her basically to do her own GPS testing. And my client looked at me and she's like, "Why won't she touch me? Like, why is she doing this?" And it's now a very common thing, but this was when I initially started a few years back before they do centering. Now they do centering program where they do have the client do their own GBS thing. But back then I was like, I don't understand why you think it's okay for a woman who is 36 weeks pregnant to do her own GBS testing. I've never heard of anything like this. And later on, the midwife did a presumptuous drug test on her. And it's like, wait, why would you think she's on drugs? Actually, her and her husband are paying for this. Like, they have their own private insurance. They're not on Medicaid or receiving anything from the government. And now this presumptive drug test that you made her take and without her consent, she now has to pay money for this, you know? So it's various things. One thing I will say, and their statistics are showing that it's due to racism, you know, systemic racism on all the levels. And I think it's 84% of them are preventable. Maternal mortality, that's such a high rate to have deaths and have them be preventable. Like, that's insane, you know? So it's the microaggressions. It is them simply not listening to them. It is the biases that they have towards women, thinking that we can tolerate more pain, you know, different things like that. Just being dismissive, essentially, to the women. And then, you know, they're telling them, I'm feeling this pain, or I have this odor, it doesn't smell right. And they're telling them it's normal. Anytime a woman has to leave her baby to come back into a facility, something's not okay. She does not want to leave her newborn baby to come into a hospital, you know, and so that it should be taken, it shouldn't be taken lightly. And most of the time it is.
Yeah. And so, I mean, how have you been able to see the benefits of having a doula with those rates going down in your communities that you've worked with?
Because we're there to support them, we're there to advocate. So there's been many times I'm like, no, let's go back to the hospital. Let's find out what's wrong with you. That's not normal. Or if they're told, oh no, you have to have a cesarean. It's like, no, let's go and question why they're telling you to do this. I think most of the doulas that I've trained with are very, I would say, hands-on. And so they're not just sitting on the bedside looking at the client, because we have some doulas who do that, you know, it's just their presence. But then we have some who are very, I would say, proactive as a doula. There's been many of times where I've had to talk to the charge and say, hey, this isn't working. This dynamic isn't working. This nurse continues to call my client's partner her baby daddy, and it's actually her husband, you know. So some of the microaggressions, you know, I've been able to stop. There was one time I was at a birth, and the lady specifically said she did not want her water broken. This was baby number 3 for her, and the midwife came in and she said, okay, well, let's go ahead and rupture your membranes. And so she's like, okay. And I said, that's actually her breaking your water. And she's like, oh, wait. No, I've asked for it. You get what I'm saying? So it's this thing where it's constantly forcing their idea of what they want, I guess, the client birth to be. Also, it's the residents, you know, they have to get as many whatever checks off that they need. And, you know, I was at a birth where I had a client who had sexual trauma, and we informed them prior that she did not want a lot of checks. And especially by residents, that there was supposed to be an actual physician that was supposed to do it. We told every shift. The first shift was amazing. Second shift came in and completely violated that. And then I was considered the angry Black woman, because I was like, no, this is not right. This woman, first off, her check was wrong, because there's no way that this woman is about to push and she's only 3 centimeters. Like, you know what I mean? Like, because she was a resident, you could tell that she wasn't familiar with checks, because even the nurse and I looked like, there's no way that's the right check, you know? But then now, because she did it wrong, now the doctor has to come in and now re-enter. And so I had to really advocate, like, you are the only one that is supposed to do anything with the client. So she delivered the baby, the OB came in and she did deliver, the attending came in. And again, she was going to have the resident suture her up. And I said, no, this isn't the time to teach her on someone who has sexual trauma. Like, I don't understand why this is so hard. And it's against her consent. She has verbally told you all this isn't what she wants, you know? So it is a fight. To be honest, coming to Ethiopia, it has been a relief because I don't have to do those day-to-day fights, you know, those arguments. And, you know, it can be challenging, not only for obviously my clients, but, you know, day in out, feeling like you're the angry Black woman all the time just because you're advocating for your client to have the birth that they desire. It, you know, it can wear you down. But, you know, I believe I'm called to the work, and so I do that.
And I mean, in regards to like prenatal care, do you feel like having the doula and enables the clients to have that increased and sooner prenatal care, start earlier than later? Because some of the risks for infant mortality is like not having prenatal care. Do you feel like, you know, because you have these doulas and advocates for the patients, that you're able to get them in for prenatal care sooner? Or are you, or how are they finding you? Or like, you know, are they finding doulas through the hospital system or through word of mouth, you know?
All of the above. So I think anyone who's looking for a doula has already been getting prenatal care. I think it's assumed that a lot of the reason why we have this infant mortality and this maternal mortality is it's put on the client. It's put on, and some of it I would say could be, but a lot of the percentage is racism. Like, I mean, it's very a hard pill to swallow, but it really is the case. When we are in a first world country and mothers are dying and there's such a high percentage that is preventable, it's racism. So much so that it's been called a public health issue. Biden administration called it a public health issue and put forth several initiatives to decrease this issue. So some would like to say, oh, it's because of high blood pressure and things like this. But then we go back to systemic racism. Most of them some of them are in food deserts. So let's address this issue. You know, as you said, some may not have access. So there's a lot of things that is rooted in systemic racism. So when we say that just because they're adding a doula, I can't add a grocery store on their corner. You know what I mean? Like I'm limited to what I can do as a doula. Some of these things are systemic and need to be addressed on that level. But I also know and say this all the time, you can't legislate the heart, you can't train the heart. So no matter how much training that they get to be culturally competent or to be accepting of someone that doesn't look like them, you can't train them to do that. That's something that God has to do, they have to choose to do. A lot of them I've seen attend certain trainings, and it's just a check off the list. It doesn't mean that the behavior will change or the biases are going to cease. Some I have noticed really, really desire to do that. And places I've seen it done well is a facility, Summa Healthcare. The OB, the head director there, he is very active in getting the doulas involved, getting the community midwives involved, so that we are all a birth team. So much so that we have our own badge when we go into the hospital at that facility. They already know who we are. They respect us as, being a part of the birth team. It's not like, us versus them, whereas other facilities, it is that, where you really have to fight for your client's rights. So it is that, some of them, it is high blood pressure. It is the preeclampsias and the gestational diabetes and such. But we still have to look at the systemic issues that afford for that to be a thing, and not to take complete responsibility off of the patient. But we really have to see what environment they're in and what the lacks are there, the health disparities, and why they're actually there. And a lot of it is systemic. Unfortunately, people don't want to hear that as the number one reason, but it really is. And studies are now proving it, which is why they are encouraging a lot of, pretty much majority of the states now are providing doulas or giving access to women to have doulas, because also studies are showing when they have doulas or providers that look like them, they actually live. These numbers decrease when we are taking care of each other.
Yeah. I mean, the medical system is already kind of a complex system and overwhelming to any patient in general. Coming in with a pregnancy, worried about your child or things like that, and you hear terminology, you hear words that you don't have an understanding of, and if there isn't someone kind of right there with you, maybe explaining things or helping you understand, or telling them like what to expect next, what to know is coming, and kind of maybe even put all of these physicians' medical terminology in more of an understandable way helps the patient. Like what you were saying is the physician was just like, okay, do you want to rupture your membranes? And she's like, okay. But then she had not wanted to, have her water broken, but it's just putting the terminology in a more understandable format for some patients to make it less daunting.
Mm-hmm.
And that's one part of what I'm seeing is that is a huge benefit of having doulas with the patients, and what you guys are doing for the patients to help them.
Mm-hmm. Most of my clients, though, like I said, anyone who is looking for a doula more than likely is educated and informed. Some of them come already with their birth plan, knowing exactly what they want. And it's like, okay, right. Most of them are, because to have that, a lot of them are literally coming because they are terrified to go to the hospital because of they see that the mortality rate is so high. And Serena Williams even had an issue. She literally almost died because they did not believe that she had a blood clot. And she kept saying, I'm at risk for a blood clot. I also just had a cesarean, which makes me even higher risk. I think something is not right. Finally, they listened to her, and yes, she had a blood clot. But she was at risk of dying. And that's Serena Williams, world-renowned athlete. So if they're not listening to her, what does the average Black woman in America, have? So a lot of my clients are coming to get a doula because they do not want to die and they don't want their baby to die. They don't even understand truly what it is that we do. They just don't want to die. And these are, like I said, educated women. Studies are showing that even a woman who is making six figures, have her degrees, all the things, is more at risk than a white woman barely finishing high school. She's more at risk to die than someone who's less educated. So it has nothing to do even with socioeconomic status. Again, we go back to racism. As much as we don't want that to be the issue, it is the issue in America, unfortunately.
Yeah, yeah. And I mean, the blood clot story reminds me of another lady I know who is Sri Lankan
Mm-hmm.
and was in Australia. She was a nurse. She was a
Mm-hmm.
practicing nurse,
Mm-hmm.
and she's very educated. Went on to do a PhD. She was pregnant with her first child. She wrote a book and everything about this. She's actually been on the news in Australia advocating for prenatal maternal health care
Mm-hmm.
there, and talking about racism as a kind of a systemic problem in the healthcare population. Even there, she's
Mm-hmm.
saying that that caused a lot of her issues, where she had unilateral swelling of one lower extremity,
Mm-hmm.
pain out of proportion. She's a nurse. She said,
Mm-hmm.
my leg needs to be evaluated. I am having extreme pain,
Mm-hmm.
swelling more so than the other leg.
Mm-hmm.
Evaluated. No one evaluated it. No one took note of it. Finally, when it started turning black and blue and, losing circulation, she was taken for surgery and had a fasciotomy, and but she lost nerve
Function. Mm-hmm.
function in that
Mm-hmm.
lower extremity, and
Mm-hmm.
now has a lot of ongoing difficulties with
Mm-hmm.
that since then, and that's like 17, 18 years ago, right?
Mm-hmm.
And so you know it's definitely a problem everywhere. There are things that have happened for sure,
Mm-hmm.
that kind of show to some of those points, right?
Mm-hmm.
And so, I mean, how else do you feel that like having a doula changes in a positive way for these patients that you work with, though?
Well, I think historically, Black women have supported one another in
Mm-hmm.
labor and have had that sister or that mother, come around. And, being in Africa, I see that often. Especially Ethiopia. I mean, the whole family comes out when a woman has a birth. She is idolized, like she is like lifted up high. It's amazing to see how
Mm-hmm.
she's lifted up. Whereas I think in America, it's like my four no more. Like you're expected to go home and take care of this human being, like with no instruction or anything. Typically, you don't really have that support. I know a lot of my African friends, or even Indian or whatever, their mom will come and spend months with them, after they have a baby. And it's not available in a lot of the African American communities. And most of my clientele for postpartum care is whites. Their families are supporting that. But because culturally, too, Blacks are not just leaving their baby with anyone. It's harder for us to even bring forth the idea of, let us come into your home and take care of your baby while you sleep. The strong Black woman can do everything, right? And so it's very hard to do that. But I've seen clients, when they do allow that, they're very appreciative of it. And so having that extra eye too, on them postpartumly, I think is another positive aspect of having a postpartum doula, because you have someone who can also alert you to some of the things that may be happening afterwards, even if it's postpartum depression or still preeclampsia afterwards, because you're still at risk for so many things after you have the baby. But most of the time, women are so focused on taking care of the child that they miss certain things, or can miss certain things, or they're sleep deprived, right? So having someone come in at night to watch their baby so that they can rest, so then when they wake up, they're able to take care of the household, is another huge advantage that I see that doulas play.
That's great. That's so interesting. So doulas even help in the postpartum period. I didn't know that.
Yes.
I thought they were more just the
Yeah.
prenatal period and birthing
Mm-hmm.
portion. But that's amazing. That makes a
Yeah.
huge difference
And
for
there's some
the
doulas who
mothers.
do that full time, where they're just postpartum doulas.
Okay.
Even bereavement doula, like I'm also a bereavement doula. So even
Okay.
if you have a loss, we know 33% of women miscarriage in the
Right.
first trimester. And so even being there to support and to help um, honor that child's life and validate that child's life. So I work for an agency there, or volunteer for an agency there, Sufficient Grace, that even at 8, 9 weeks, we've gone out for miscarriages and to help, do fingerprints, getting finger and footprints of the child so that they can have those keepsakes with them, all the way into, stillborns at 33, 36, 37 weeks, and helping them make the arrangements or whatnot. So I oftentimes tell my clients early on, hey, I'm not here for you just for a live baby. God forbid you have a stillborn or a miscarriage. I'm here to also help you through that process, because we know a lot of women suffer in silence with that as well.
Yeah.
So there's also doulas that help through that process as well.
That's amazing. So, how can we incorporate better care for patients and mothers, and in Black populations? Because you're saying that that's a huge problem that they're facing. What
Mhm.
can we do to change our ways of care for the populations and maybe mitigate these issues they're
I think,
facing?
yeah, I think the biggest thing is, like I said, one of the lyrics in my song is to treat them like your mother, sister, daughter. Truly look at the person whom you're taking care of. The golden rule: treat someone the way you want to be treated. And you want to be heard. You want to be taken seriously when, you bring up an issue or a concern. You want to be educated too, not just assumed that you know certain things, or assume that you don't know certain things. And so just truly, just the golden rule is to truly treat that person like you want to be treated. One of the things here in Ethiopia, I realize is that sometimes the bed care manner is a little different, because it is kind of like you're off to your own. And I see some of the similar things in America, where they're not truly attended to. They're kind of left alone um, during that process. And so, yeah, I think my number one answer would be because there's many things, but ultimately, if every physician, every nurse, every tech truly treated each patient like they wanted to be treated or as if they were serving a family member, I'm almost certain that these numbers can go down drastically. Drastically.
Yeah. Has anything improved in the years that you've practiced as a doula and worked with different healthcare organizations and communities? Has anything improved? Or has it just been like if they listened more, then things improved a little bit more? Has anything else been a factor for any improvement that you've seen?
I don't have numbers because I'm more of the person on the ground. I do have lovely friends that can help with those numbers. From my understanding, numbers were down when the Black Birth Collective or the Black Birth and Beautiful Communities first started. They saw numbers drastically go, I'm not going to say drastically, but go down. It's under different leadership now. And actually, I was looking at the Google reviews the other day, and it's not the best. Like a lot of the patients are not even getting doulas, so they're not even able to experience having a doula there, which is unfortunate. However, I guess to answer your question, I don't know how things have gone down because I feel like what I've seen in times past is that the numbers aren't that different from the 80s and 90s when this was an issue. The numbers that we have now are similar, if not more. So we know billions of dollars since then have gone into this work. And things haven't changed. And so one of the biggest thing I know within the Black Birth Collective and the Black Birth community is that we want to change the narrative. We want to stop speaking death into the situation and speaking life. Like, yes, we know that we're dying. Yes, they told us that. But if we can continue to let that be the narrative rather than birth is actually a very joyous time, very spiritual, very sacred time. When we start promoting those things and changing the narrative so that the client is not afraid, they're not going in with these anxieties, which can impact their blood pressure and, things, but they can now look forward to having a birth and not being afraid, then maybe that also can help change it. So there's a huge movement of a lot of Black birth workers wanting to change the narrative and add joy back to it, and not the,
Fear.
the fear of it, of dying. Because yes, that is a reality. Yes, the numbers are there to show that, but we want the narrative to change to promote life and to promote a more joyous, sacred, spiritual experience.
And any other things that we can kind of change with like community partners or medical communities that could better advocate on behalf of BIPOC communities?
I think listen to birth workers, choose to partner with them, choose to let them be the expert, right? Put them in seats of leadership. They need a seat at the table. Like I said, the organization, the hospital in Akron, Summa Health, we literally have quarterly meetings that we have where they are welcoming us in to discuss different issues that we have, to bring forth our feedback. And so we truly feel like we are a part of the team. And I think that's missing in a lot of healthcare facilities. I don't even know how many healthcare facilities even have BIPOC people at the table of leadership to where they can help encourage different changes that need to be implemented in these systems. I think it's very important to have a seat at the table to get a different perspective and not be led by um, perhaps white people with the same biases that will perpetuate the same things. Maybe having other BIPOC people there so you can get a different perspective than that's typical. I think that's a huge thing, as well as having us at the table, especially birth workers, community midwives, and birth workers, having forums. I was able to help facilitate a doula meet and greet at one of our hospitals at Fairview, and I wanted it to be a regular thing, and somehow it trickled off. We had, I think, about 2 meetings, and then I've not heard of anything else from it. But having those open forums to where doulas can share their experiences, then you can hear what's actually happening in these birth rooms, and being able to do the necessary changes that need to happen to promote better, outcomes.
Yeah. And you've worked in different countries in Africa and around the world. You've visited so many different places. So, what is your experience globally within this kind of community and working experience? I know just now you were telling me you're working with like educating where the local midwives or nurses and kind of talking about your experiences and all. But tell us a little bit about like how you kind of get to participate globally in this.
My heart desire is truly to get medical supplies, because that is one of the things that breaks my heart when I'm in these places. We have qualified physicians and midwives and nurses, but they don't have their supplies. I was just in Kenya, and I work closely, or I'm connected with a midwife there, really dear friend of mine. And last time I was able to bring nipple shields and a variety of other things. And she was like, I just gave away the last nipple shield. And she told me how that nipple shield drastically transformed how the mother was nursing and the baby latching. Such a small thing that could help improve the family structure, you know what I mean? That can help a mother know that her child is being fed properly, can also help with her mental health. There's so many things that just that one small thing can help change in the family dynamic. When I was in Senegal, I was welcome to shadow OB residents. And I was really saddened that they didn't even have Dopplers. And here I am as a birth ambassador. I have 2 in my midwife assistant bag. Something, again, so simple that can help improve outcomes and allow them to be alerted when there's an issue. I was there for a loss. It was so sad. They had 3 women in the same, basically, room. One had just delivered, one had delivered probably an hour or 2 before, and one was rushed in because she was delivering a stillbirth. And it was very hard, because you've had children, right? How in the world would you respond to being in the same room after you have your baby to a woman who just lost her baby? That scene was just, I couldn't believe it, right? So being able to help provide the basic, because even a divider, something that can help to where that woman didn't have to literally look to her left and see this other woman going through such a traumatic, situation. Um, yeah, I'm connected with the organization called MedWish there. It's literally a warehouse filled with medical supplies and equipment. A warehouse. Things that people need in these other countries that's sitting in a warehouse. The only hindrance is money, to get these things over to these places. So I don't necessarily see some of the racial things here that I see in America. It's more the lack of things, the lack of supplies that I see. And, we have then corruption that, sometimes also hinders that. So when I am able to bring suitcases filled with supplies, I bring so much stuff over. My heart desires to be able to get these containers filled, which are only $8,000. Like, that's nothing for someone who is a millionaire or whatever, And it's not a lot, but that container would be filled with medical equipment and supplies. So those are the things I see or have seen that hinders people to getting the quality of care that they need. Also, sometimes training. I, recently had to have an emergency surgery, and one of the things I was shook by, I just could not believe that when they did my EKG, they were doing the suction EKG. I'm like, this has to be the first model of an EKG because I have never seen one like this before. This clearly has to be the first design. But something like that, we have EKG machines there that we can bring over that can help the quality of care, and different trainings. So like me being able to be here and inform them of spinning babies can help them decrease the cesarean rate that they have. Here, the public health centers here, they don't even allow the woman to try to have a vaginal birth. They rather just do a CS. You know why? Because it's more money that they get. And so, again, education and training and being able to inform the mothers here too that yes, it can be painful, but there's different techniques. There's spinning babies that can help turn the baby so that you're not having back labor, that your labor is not long, so you can endure it to be able to have a vaginal birth. So also education. So hopefully, like I had a meeting today with the public health officer, and that's our heart desire too, to help be able to prepare women mentally prior to labor so that they can, endure and have vaginal births and have the tools that they need that can help with that. So there's a variety of things I feel like here that can help benefit the people here. So it's more supplies, medical supplies, and education training, I think, will help them.
Yeah, it's amazing to see, the different needs in different places around the world, and what each community faces is sometimes the same, but of course, always different too. And so, but Marlene, it was such a pleasure to speak with you and hear your heart for women and their children, and to see, not just here in the US, but globally, and how you're working to support so many. And so I really appreciate your time. I know you're across the world right now, and with the time difference and everything, we've managed to make a time to speak. And so thank you again. And I hope that those who are listening will be able to spark hope in their communities, in their families, by listening to others who are different than themselves, and open up their perspectives to hear and understand what others may experience, what others may think. Everybody has a different perspective, a different journey that they've been on. And that's kind of one of the reasons why I started this podcast, is to allow people to hear those different perspectives, to hear those different journeys, and hopefully open themselves up to understanding others better. So thank you again so much. Spark hope wherever you are.
Yes.
Have a great week ahead.
Thank you so much. It is definitely a privilege, and I appreciate your patience with me and giving me the opportunity to share my perspective and my passion. So thank you as well.
Yes, thank you so much. Thank you for joining us on this episode of Medicine, Motherhood, Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. Until next time, keep sparking hope, keep healing, keep nurturing, and keep making a difference. This is Johanna signing off from Medicine, Motherhood, Missions. The medical opinions expressed on this podcast are for the informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical questions or concerns. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.